जी प्रेसमीट आहे ती ओपाय 2022 या संदर्भात आहे आणि ही जी काय परिषद होणार आहे ती 28, 29, 30 असे 3 दिवस होणार आहे. आणि आज आपल्यामध्ये त्याचे जे ऑर्गनायझिंग सेक्रेटरी आहेत ते आहेत डॉक्टर राजेंद्र कशाळकर आणि याच्या पुढचं सूत्र जे आहे ते त्यांच्याकडे देतं आणि ते ओळख वगैरे करून देतील आणि ह्या परिषदेबद्दल तुम्हाला योग्य ती माहिती देतील आणि ते झाल्यानंतर तुम्ही प्रश्नोत्तर जे काही आहे ते विचारू शकता. थँक्यू. नाही बसून बोला.
गुड इव्हनिंग सगळ्यांना. माझं नाव राजेंद्र कशाळकर. मी बेसिकली फ्रॉम रत्नागिरी महाराष्ट्र आणि मी प्रोस्थेटिक्स ऑर्थोटिक्स या विषयामधला ह्या विषयाचे तज्ज्ञ आहे आणि गेली 30-35 वर्ष मी ह्याच्यामध्ये आहे क्षेत्रामध्ये. आता आमची नॅशनल असोसिएशन फॉर द ऑर्थोटिक्स अँड प्रोस्थेटिक्स असोसिएशन ऑफ इंडिया ही आमची एक गेली जवळ 25 वर्षांची एक संस्था आहे की जी अशा सगळे जे प्रोफेशनल्स आहेत भारतभरातले ते एकत्रित होऊन आपल्या प्रोफेशनसाठी आणि आपल्या दिव्यांगांसाठी काम करत असतात. यावर्षी आम्ही दर 2 वर्षांनी आम्ही एक आमची एक मीट असते, नॅशनल कॉन्फरन्स असते. ह्या वर्षीचा मान आपल्याला गोवा राज्याला मिळालेला आहे आणि गोवा राज्यामध्ये आपल्याकडे ह्या पद्धतीचं रिहॅबिलिटेशन फॉर द फिजिकली हँडिकॅप ह्या विषयाचं काहीही म्हणजे तसं काही ॲक्टिव्हिटी काही झालेली नाही. So we thought of having a conference here so that the movement for the rehabilitation of the people can be encouraged. So that was the basic criteria and basic idea होती. त्या पद्धतीने आज आमच्याबरोबर आमचे नॅशनल प्रेसिडेंट आहेत डॉक्टर माधवराज सर and Dr. Patra sir. He is from Tamil Nadu. Dr. Patra sir is from Orissa. Dr. Rajendra Kumar is from Delhi, and Dr. Pandian sir is also from Delhi. That Institute for the Physically Handicapped.
पूर्ण जरा नाव सांग.
हो देतो. Dr. Dr. Pandian. G. Pandian.
He is
Vice President of the Association of India.
And I am
Dr. B. Madhavraj, the National President and the Chairman of this organizing program. Dr. Patra sir, he is from Orissa. Patra first. Arantaran Patra. A Patra.
He is the National Secretary.
He is a National Secretary.
Chairman for Scientific Committee.
And Dr. Rajendra Kumar, he is also Executive Council member.
Mr. Rajendra Kasimkar is the Organizing Secretary.
And the Organizing Secretary for this conference. आणि आता ह्या विषयामध्ये मी तुम्हाला मराठीमध्ये सांगतो. ओके सॉरी. देन प्रोस्थेटिक्स ऑर्थोटिक्स हा विषय आहे की जिथे अपंगांचं रिहॅबिलिटेशन पुनर्वसन आपण करतो. ह्या याच्यामध्ये जे दिव्यांग असतात ज्यांना पोलिओ, पॅरालिसिस, फ्रॅक्चर्स अशा पद्धतीने काही जे झालेले असतात, दुखापती झालेले असतात किंवा ज्यांना हे आजार असतात त्यांना आपल्याला असिस्टिव्ह स्प्लिट्स, त्यांना चालणं योग्य होणं किंवा त्यांना अतिशय त्यांचं जीवन चांगलं होण्यासाठी आपण ऑर्थोटिक्स म्हणजे ज्यांना सपोर्टिव्ह अप्लायन्सेस बनवतो. आणि प्रोस्थेटिक्स म्हणजे ज्यांचे पाय अपघाताने काही पाय गेलेले आहेत, हात गेलेले आहे किंवा त्यांची बोटं गेलेली आहेत, काही त्यांचे अवयव गमावलेले आहेत, त्यांच्यासाठी आपण रिस्टोरेशन करतो. सो वी मेक एन आर्टिफिशियल लेग, आर्टिफिशियल हँड अँड दॅट आर्टिफिशियल म्हणजे रिप्लेसमेंट ऑफ अ बॉडी पार्ट. सो दॅट इज प्रोस्थेटिक्स. प्रोस्थेटिक्समध्ये आपण पूर्ण रिप्लेसमेंट करतो. जो लॉस ऑफ बॉडी झालेली आहे त्याची आपण रिप्लेसमेंट करून त्याला वी मेकिंग वॉक, वी मेकिंग मोबिलाइज. आणि ऑर्थोटिक्समध्ये वी गिव्ह एक्सटर्नल सपोर्ट, एक्सटर्नल गॅजेट्स. सो we want to make him as normal mobilization. तर हे ऑर्थोटिक्स अँड प्रोस्थेटिक्स आमची संस्था जी आहे ओपाय 22 ऑर्थोटिक्स अँड प्रोस्थेटिक्स असोसिएशन ऑफ इंडिया 2022 आपलं ह्या वर्ष आयोजन आहे. ह्या वर्षीचं आयोजनाचं आम्हाला 27, 28, 29, 30 पण आमचं 27ला प्री कॉन्फरन्स वर्कशॉप आमच्या प्रोग्राममध्ये जी भारतभरातून जी मुलं आमचे जे कॉलेजेस आहेत कॉलेजमधून जी मुलं शिकत आहेत त्यांचं आम्हाला स्टुडंट्सना थोडंसं एनकरेज करण्यासाठी, अपग्रेड करण्यासाठी रिसर्च ॲक्टिव्हिटी काय चालू आहे आणि त्याच्या ज्ञानात भर करण्यासाठी वी ऑल कम टुगेदर 2 times once in 2 years. तर 2 वर्षातून एकदा आम्ही एकत्र येतो, त्याच्यातून आम्ही एक्सचेंज ऑफ नॉलेज करतो आणि त्यामधून आपण ते सगळं त्यांना मुलांना शिकवतो. तर हे सगळं एक्सचेंज ऑफ नॉलेज आणि हे सगळं आमचं त्या निमित्तानं होणार आहे. 28 तारखेला सकाळी 11 वाजता रमाकांत खलप यांच्याकडून यांच्या हस्ते आमचं उद्घाटन होणार आहे. रमाकांत खलप यू ऑल नोज एज एक्स लॉ मिनिस्टर ऑफ गव्हर्नमेंट ऑफ इंडिया प्लस डेप्युटी चीफ मिनिस्टर ऑफ गोवा आणि ही हॅज ॲक्सेप्टेड अवर इन्व्हिटेशन, सो ही विल बी देअर. आमच्याबरोबर आणखी इन्स्टिट्यूट फॉर फिजिकली हँडिकॅपचे डायरेक्टर फ्रॉम दिल्ली ते पण आमच्याकडे येणार आहेत. आणखी मेनी मोर डिग्रीज आर देअर. Commissioner for the Disability of Government of Goa, Gurunath Pavaskar is also coming. So there are many more personalities will be available there. So एकूणच आमची ही जी कॉन्फरन्स आहे ह्या निमित्ताने अपंगांसाठी किंवा दिव्यांगांसाठी आपल्याला काय जास्तीत जास्त काही ह्याच्यामध्ये मदत करता येईल किंवा त्यांच्या अपग्रेडेशन करता येईल, जसं लाईफ आणखी नॉर्मल कसं करता येईल. कारण टेक्नॉलॉजी हॅज रिच्ड सो वास्ट. पूर्वी जसं तुम्ही फक्त जयपूर फूड ऐकलं असेल, आपण जयपूर फूड म्हणजे आर्टिफिशियल लिंब बनवतो, पण जयपूर फूड आता खूप मागे गेलं. आता खूप आर्टिफिशियल टेक्नॉलॉजी चांगली झाली आहे, त्यांचं लाईफ आणखी सुकर झालेलं आहे आणि त्यांना खूप आपल्या नॉर्मल प्रवाहामध्ये चालता येतं. इवन आपण शासनाच्या वेगवेगळ्या ज्या सवलती आहेत, इवन आपण ज्या शाळांमधून जे कॅम्प्स करतात अपंगांसाठीच्या किंवा त्यांची तपासणी करतात, त्यांना आपण अप्लायन्सेस करतो. हे सगळ्या ॲक्टिव्हिटीज आमचे जे प्रोफेशनल्स ऑल ओव्हर भारतामध्ये आहेत ते सगळे प्रोफेशनल्स प्रत्येकाच्या माध्यमातून, शासनाच्या माध्यमातून, NGOच्या माध्यमातून, स्वतंत्र खाजगीरित्या हे सगळे ह्या प्रवाहामध्ये काम करत असतात. तर हा असा एक आमचा इतिहास आहे आणि अनेक वर्ष जवळजवळ 50-60 आम्ही माझ्या मैत्रिणी 1963ला ऑल इंडिया इन्स्टिट्यूट ऑफ फिजिकल मेडिसिन ऑफ रिहॅबिलिटेशन हजेली मुंबईला 1963ला पहिली सुरुवात झाली. सुरुवातीला पहिला फक्त सर्टिफिकेट कोर्स होते, त्याच्यानंतर डिप्लोमा कोर्स झाले, त्याच्यानंतर ग्रॅज्युएट कोर्स झाले आणि त्याच्यानंतर आता मास्टर्स कोर्स आहेत. तर हे सगळं इतकं चेंज होत गेलं आणि खूप चांगले आता टेक्नॉलॉजी आणि रिसर्च आणि ॲक्टिव्हिटीमध्ये आता आपण खूप चांगलं हे कार्य करतो आहोत. दिव्यांगांसाठी त्यांना जे काही चांगल्या पद्धतीने त्यांना त्याचं लाईफ नॉर्मल होईल यासाठीचा आमचा सगळा प्रयत्न आहे. सो आय थिंक फ्रॉम माय साईड म्हणजे मी I have finished my this thing. I will request President sir to say in English.
So I think Mr. Rajendra has explained almost all about our profession in this own language. So what is the prosthetics and the orthotics? Orthotics is the external support for the disabled persons, those who are getting paralysis and other cervical pain and leg pain. All these things, it is called as the external support, we call it as orthotics. And the prosthetics is those who lost the limb. If some person lost the finger, we will give the cosmetic silicone cosmetic finger for them. If those who lost the upper extremity, that is below elbow or above elbow or shoulder discharge, something like that. Now we are giving that external support called as even though for lower limbs also. That called as a prosthetics, external giving that is replacement of dignity, foot or leg, whatever it is. So that is called orthotics and prosthetics. So orthotics and prosthetics, this has been started in the year 1972 as a diploma course. Now it has been upgraded in the last 15 years back as a degree for 4.5 years. These 13 institutions are there in all over the country. So almost more than 2,000 professionals have completed this prosthetic and orthotics courses, and they are working in government sector as well as private clinics and multinational companies all over India as well as in abroad. Now it has become a PhD courses. PhD also coming for prosthetic orthotics in India. So once in 2 years we have this association called as Orthotics and Prosthetic Association of India. It has been started in the year 1979. Now, once in 2 years, we conduct the conference to share the views, to upgrade the knowledge, as well as to know the new products by the exhibitors from multinational company and Indian companies, those who are producing the supportive device as well as the artificial limb materials. So we will exchange we have the scientific session also. That is the main concept of conducting this conference is to exchange the knowledge, to upgrade the professional subjects. those who are done the research and everything, so they will submit the papers, research papers and new developments. As well as for the students, we have separate session, and for professionals, we have separate session, scientific session. It will be for 3 days. We are conducting once in 2 years in various places of the country. This is the 26th National Conference. We are doing it in Goa because most of our members are very eager to conduct in Goa for last more than 10 years. So we have decided to conduct the 26th National Conference at Goa. We are doing this conference in Panjim Convention Center from 28th to 30th. 27th we have pre-conference. That is, the companies, multinational companies and other companies will give the workshop. That is hands-on workshop. How to produce, how to this, what is their new development like that. Previous, that called as a pre-conference workshop. That it is, so almost it is 4 days program. First day we are keeping inauguration session around 11 o'clock. I invite on behalf of our organizing committee all our friends and everybody has to come and participate there and felicitate us and make the news to all the papers and media. I request everyone to come there on inaugural session. On the final day, that is on 30th, we have the validity session. Validity session we are expecting with the support of Mr. Joshi. We will get some VVIP of the government of Goa, either a health minister, if we are lucky, then we can get the chief minister appointment also. That not because of us, Mr. Joshi is helping like a brother as well as our association charter member like that. So first of all, we are thanking for him also for helping us in all aspects. So this is about the conference. So if any question is there, we are ready to answer. Yes, sir.
I have a question.
Yes.
I'm a journalist and also a member of Goa State Disability Advisory Board, Apex body.
Yes.
As you say, the technology is evolving and that is helping persons with disability, orthopedic and all other. But the problem is two ways. One, awareness among people, especially non-urban people, is still less. That is one. And second, technology, when you extend it, extension of technology should be affordable. That affordability part plays a big role. Many people can't afford it. They know it. So how you play that role?
So normally this is happening all over the country. So we are writing to this totally these schemes are implemented by the Ministry of Social Justice and Empowerment, Government of India. Their main concentration is to give the tricycle, wheelchairs and the crutches and other artificial mobility aids, and they are giving these artificial limbs also through Alinco. So what we are insisting for example, I am telling in government of Tamil Nadu, what they are doing, the government chief minister's health insurance scheme is there. Now the prime minister health insurance scheme also there. So they are clubbed both in Tamil Nadu. That is, I am telling as an example. So what they are doing in Tamil Nadu, they have all 32 districts, they have the district disability rehabilitation center they have made. So even the district officer as well as the prosthetic orthotic professional, physiotherapist, occupational therapist, everybody they appointed in each district. So they are going for the rural areas and they have the mobile van also to go and treat the patient in their home itself, doorstep. That we are writing letter to the government of India, taking this as a role model and implementing all the states, so that we cannot, everywhere they can reach. Mobile van, if it is there, district will be around 30 to 35 kilometers range only. So the district people can easily go and approach the beneficiaries. Beneficiaries also will get. And the district officers will put the banner that what are all the facilities available, what are all the new, one those who lost the limb by accident, then he can wear that, he cannot afford if it is a poor person. Then the government has given that insurance scheme by giving that multinational companies material is there, then they are giving in Tamil Nadu they are implementing. That cost below knee limb itself cost from 60,000 to 1,50,000. For above knee it is coming for up to 3 lakhs they are giving. So we are writing letters to the government, including the Prime Minister also. We have written many letters to implement same all over the country. So the all disabled persons will get the benefit out of that. The government is not going to lose much crores.
Correct.
It will not it will help to all. Then it will help for the family also. Ultimately, when he put the limb, he will go for job.
Absolutely.
Otherwise, he will sit in the home. It will be burden for their family also. So we have written all the letters to Government of India as well as Health Ministry, including the Prime Minister and the Finance Minister to implement this in the budget itself. But nothing has come. Anyhow, we are trying our level best.
Another related issue here is now you said wheelchairs and all are supplied by the government.
Yeah.
There is a central corporation, I did not tell you, but they are giving that work on outsourcing basis. And often we as members of Disability Advisory Board, we get complaints from people that wheelchairs and other supplement things which are supplied are inferior quality. Within 6 months they break down. People complain. So for that, what your association should be working to ensure that this quality management is done. Please take it up.
Yeah, we three members are in the Bureau of Indian Standards also. Myself and Mr. Patra, we are in the rehabilitation equipment, and Mr. Pandit, Dr. Pandit also there. So we are insisting whenever the committee meets, we are insisting that we should not compromise the quality. But as per the BSI standard, it should come for 2 years minimum.
The whole
Minimum
camp.
if not in the plain surface. If it is in the rural area, if some mud and some water everywhere, if we use also, it should come for 2 years. That is the BIS standard. But we are writing letter to some concerned person also. I don't want to spell out the
And
name.
also one suggestion is that every 3 years these camps are held in the states. Try and do that at least yearly. That is what parents, bodies of special schools, they have been telling us. That 3 years gap is too much. Once it is done in Goa, after 3 years again you do that camp of supplying these things. So please take up this kind of
Instead
issue.
camps, if they can establish the centers, district
Absolutely,
centers.
that is the
That is the
best
best.
thing.
We are trying our best. We are
Okay.
writing to ministry.
Yes.
That you establish the centers so that people can reach to the centers.
Absolutely.
And they can get that.
Yes.
Now, what my request is, on behalf of your association, you can very well contact your government, whoever is the social minister, social welfare minister or health minister, which one is coming under this
Yeah,
control.
in Goa there is
you-
social
you
welfare
ask,
department.
How many district is there, I don't know.
2
But
districts.
yeah, then you ask them to establish a 4
Centers.
centers. Then the district officer and the prosthetic orthotic professionals will be there. I think cost will not be there, not much. If government spends for 50 crores or 25 crores, it will be more than enough to give the appliances as well as to implement this scheme, as per as my assessment.
I will tell the disability
Yeah.
commissioner to write to.
Yes.
Definitely.
Today, I had a discussion with the commissioner.
Okay.
And he has accepted the request for attendance, plus the long vision, not the short term.
Yes.
We will move to, because of this event, of this organization, of the meet, this will develop a long run relationship to
With the
establish
state.
a center, and we'll move, what I understand is the people goes out, go to the south and the other Mumbai and all that. So instead of that, if we establish a center over here with the help of government, I think Government Medical College Bamboli has that unit.
Yes.
But that has to be
Upgraded
reinforced,
and-
upgraded and all that. So if you people have, if you all take the measures and start the movement for upgrading and see, so that will definitely, take a step, next step.
Our association can give what is the latest equipments can be put in that center. What are all things to be established in that center? What is new machinery is available, where it is available, what will be the cost of the machinery, what will be the establishment cost for the professional as well as for the district officers, how much it will take per year. All budget, if you want, we can provide you. Then based on that, you can submit the representation to the government. Then it will be easy for them to assess whether to implement, where to implement, everything they can decide. That we can support.
सर फॉर एक्झाम्पल कसं असतं आता कोणाचा पाय काढ बिलोनी अम्प्युटेशन झालंय तर कॉज ऑफ अम्प्युटेशन काय आहे डायबिटीज मोस्टली 70-80% डायबिटीज असतात पण डायबिटीज पेशंटला आपण जेव्हा रिस्टोरेशन करतो आर्टिफिशियल लिंब बनवतो तेव्हा आपल्याला त्याच्या पायाची पण काळजी घेतली पाहिजे म्हणजे त्याला पुन्हा काही जखमा होता कामा नये आणि कुठले हे होता कामा नये मग त्या पद्धतीने आता टेक्नॉलॉजी इज डेव्हलप्ड मग आपल्याला त्या आपण ते जे कॅम्प करतो आणि असे मास स्केलमध्ये दॅट इज ऑफ नो यूज अँड दॅट विल मेक अन अनदर कॉन्फ्लिक्ट त्यापेक्षा असं कस्टम मेड हे सगळं कस्टम मेड असतं सर मला तुमच्यासाठी तुमच्या पद्धतीने तुमचे एज तुमचं प्रोफेशन तुमची वर्किंग कॅपॅसिटी काय आहे त्या पद्धतीने आपण डिसाईड करतो त्या पद्धतीने आपण देतो सो इट शुड बी टार्गेटेड टू द बेनिफिशरीज आणि ॲज पर हिज रिक्वायरमेंट्स ॲज पर हिज नीड्स तर त्या पद्धतीने आपल्याला आम्ही हे जे प्रोफेशनल्स आम्ही जे करतो त्या पद्धतीने करतो विथ दिस मीट ॲटलिस्ट त्यांनी कुठेतरी सुरुवात होईल ह्या मुवमेंटला सो आय जस्ट रिक्वेस्ट तुम्हाला सगळ्यांना आपलं मदत आहे हे आहे रिक्वेस्ट आहे की तुम्ही ह्या पद्धतीने थोडी मुवमेंट एक 2-3 दिवस मी आता काही राईटअप थोडेसे मराठीमध्ये केले त्या पद्धतीने मी त्याच्यामध्ये लिहिलं की काय गरज आहे किंवा काय आहे तर ते सगळं तुम्ही थोडंसं एम्फसाईज करून लोकांपर्यंत पोहोचवलं तर त्याने एकदा चळवळ तयार होईल आणि जे अजूनही म्हणजे जे अवेअरनेस आहे तोही वाढवता येईल त्यांना आपल्याला चांगल्या सगळ्या फॅसिलिटीज आपण डेव्हलप करता येईल आणखी काही प्रश्न आहे सर जिसा सर इज डुईंग अ लॉट ऑफ वर्क. You can discuss it after. Yeah.